Hello, I'm Professor John Dillon. I'm a consultant hepatologist here at Nine Wells Hospital in Tayside, and I'd like to talk to you today about a new way of managing abnormal liver function tests. Firstly, why do we need to think of a new way of managing liver function tests? Well, we're doing many more tests than we've ever done before, and about 20% of them are abnormal, so that creates a significant problem for us as to what we should do with abnormal liver function tests. And that's coupled with the fact that the rate of liver disease is increasing. If we look at this first slide, this shows that the rate of death in the under 65s is increasing in comparison to the decline for all other diseases, and that within the next year or so, chronic liver disease is likely to become the commonest cause of death for those people under 65. So we have come up with this idea of using intelligent liver function testing to try and make life easier for everyone involved in the management of it all. So if a patient comes to you and you're considering testing them for their liver function test because you think that their new symptoms may be related to liver disease, then this system is for you. If you're doing the liver function test because they already have liver disease, or because you're monitoring a drug or a chronic condition that means you want to check their liver function test as well, then you just carry on using liver function testing as you have done before. So for the patients that you suspect are a new presentation and might have liver disease, you request liver function tests in the normal way. And on the first screen, when you go into your ICE, you'll see an iLFT box, and once you tick that box, it will automatically populate the rest of the liver function test for you. But a second box on this slide will appear that requests you to fill in the BMI of the patient approximately, roughly whether they're drinking more or less than the government recommendations about alcohol, and whether they have any other features of the metabolic syndrome such as type 2 diabetes, hypercholesterolemia, hypertension, ischemic heart disease, etc. Once you've done that, that's the job finished, and the blood is taken from the patient and goes to the lab. Now within the lab, what happens then is in real time, the machines will recognise if the liver tests are abnormal, and if they're abnormal, they will then do a complete liver screen for you, looking for immunology, virology, ferritin, alpha-1 antitrypsin, and all of the other components of the liver screen. In addition, the lab will also measure fibrosis markers that will estimate how much scarring there is in the liver. All of that information is then fed back to you with an automated diagnosis as well. And if we look at the next slide, and if you look at the top of the ICE report, you will see links to the diagnostic management plans for all of those patients that will explain how those patients should be managed. Now, those management plans can be accessed through those URLs on the top of the ICE report, or alternatively, you can look them up in a paper copy of the manual that you'll be given as part of this project. So intelligent liver function testing is going to be rolled out across the whole of Tayside because we've trialled it in Tayside within practices, and we have found that in the practice that used it, it reduced the workload for the investigation of patients with abnormal liver function tests. It increased the diagnosis rate from about 10% up to over 60%. It saved money, and it also had a modest effect on saving patients' lives. So this really is a story that's almost too good to be true. Intelligent liver function testing will make it much easier for you to manage and look after your patients with abnormal liver function tests, and will reduce your workload as well. Hopefully in the next few days you'll get the opportunity to use it, as it's available on ICE, and we'll find it's as successful as possible. And if you find difficulties with it, please let us know and we can try and adjust the problems or solve those issues for you. Thank you for your attention.